Gastritis. Definition. Gastritis is an inflammation of the stomach lining. It can have many causes. The condition can be an acute or chronic issue that increases the risk of other conditions, such as stomach ulcers, bleeding, or cancer. Gastritis, also called dyspepsia, is an inflammation, swelling and irritation of the lining of the stomach. It can occur suddenly, acute, or gradually, chronic. Types. There are two main types of gastritis. Erosive gastritis. This form of gastritis is severe, and involves both inflammation and the gradual wearing down of the stomach lining. An example is acute stress gastritis, which follows changes due to critical illness. Non-erosive gastritis. The non-erosive form of gastritis involves changes in the stomach lining. Other types include infectious gastritis not caused by H. pylori. Viruses or fungi can cause gastritis in people with immune difficulties or long-term illnesses. Radiation gastritis. Exposure of the abdominal area to radiation can irritate the stomach lining. Eosinophilic gastritis. This form of gastritis can occur due to an allergic reaction. The cause of the allergic reaction is not known. Menetrier disease. This disorder is rare and involves the development of thick folds and cysts on the stomach wall. Classification. Risk factors. Risk factors for gastritis include bacterial infections, especially H. pylori infection, viral, fungal, or parasitic infections, smoking, caffeine intake, excessive alcohol intake, cocaine use, stress, routine use of pain medications, such as non-steroidal anti-inflammatory medications, NSAIDs. Regularly taking medications such as prescription steroids, chemotherapy, potassium supplements, and iron being an older adult. Swallowing corrosives or foreign objects. Having an autoimmune disorder such as Hashimoto's disease or type 1 diabetes. Vitamin B12 deficiency. HIV. Crohn's disease. Bile reflux after undergoing stomach surgery. A history of chronic vomiting. Exposure to radiation, either by radioactive treatment or contamination. Food allergies. Other infections that can increase the risk of gastritis include tuberculosis and syphilis. Causes. Gastritis can be caused by irritation due to excessive alcohol use, chronic vomiting, stress, or the use of certain medications, such as aspirin or anti-inflammatory drugs. It may also be caused by any of the following. Helicobacter pylori, a bacteria that lives in the mucous lining of the stomach. Without treatment, the infection can lead to ulcers and, rarely, stomach cancer. Pernicious anemia, a form of anemia that occurs when the stomach lacks a naturally occurring substance that is needed to properly absorb and digest vitamin B12. Bile reflux, a backflow of bile, a liquid that is secreted by the liver and helps with digestion, into the stomach. Infections caused by bacteria and viruses. Autoimmune disorders. If gastritis is not treated, it can lead to severe blood loss or, in rare cases, can increase the risk of developing stomach cancer. Symptoms. Symptoms of gastritis vary among individuals. Many people have no symptoms. The most common symptoms include nausea, abdominal bloating, vomiting, indigestion, hiccups, loss of appetite, vomiting blood or coffee ground-like material, black, tarry stool. Diagnosis. Gastritis may be diagnosed using the following: the medical history of an individual and their current symptoms, physical examination, evaluation for H. pylori by way of blood, breath, or stool testing, endoscopy, electrocardiogram, X-rays of the esophagus, stomach, and small intestine. These X-rays are sometimes referred to as an upper gastrointestinal series or a barium swallow. A doctor may also request blood tests, urine tests, evaluations of kidney and liver function, checks for anemia, Gallbladder and pancreas function tests. Pregnancy tests. Female. Stool evaluation. Medical management. Treatment for gastritis is dependent on several factors. These include the cause of the condition and whether the presentation of gastritis is acute or chronic. Treatment options for gastritis involve a range of medications, such as antibiotic medications. A 10 to 14-day course of antibiotics can directly attack H. pylori. Regimens may include clarithromycin and metronidazole. Proton pump inhibitors. These include omeprazole and lansoprazole. Proton pump inhibitors block the production of acid and aid healing. Histamine, H-2 blockers. Histamine blockers, such as famotidine, can decrease acid production. Proton pump inhibitors, pantoprazole. Antacids. These can neutralize stomach acid. Coating agents. Sucralfate or misoprostol can coat and protect the stomach lining. Anti-nausea medications. This type of medication can reduce sickness symptoms. Perinom, domperidone. The treatment depends on the cause. For example, if the cause of gastritis is not bacterial, antibiotics will have no effect. Dietary management. Foods to eat. Probiotic yogurt is safe to eat during gastritis and can also help to clear out the H. pylori infection. Both broccoli sprout and probiotic yogurt have demonstrated helpful effects that counter H. pylori. However, there remains no concrete evidence that broccoli sprouts reliably keep gastritis at bay. Probiotic yogurt has shown great promise as a supporting treatment alongside antibiotics, but more research is required to confirm this. Some studies have shown that probiotics help to clear out infection. Other foods that are safe to consume during a case of gastritis include apples, berries, olive oil, honey, herbal teas. Foods to avoid. Some foods and beverages can aggravate the symptoms of gastritis and should not be eaten while the disease is active. These include caffeinated drinks, regular and decaffeinated coffee, mint, green, and black teas, orange and grapefruit juices, alcohol beverages, spicy foods, such as chili powder, hot peppers, nutmeg, and black pepper, dairy foods made from whole milk and straw-in or spicy cheeses, tomato products, chocolate. When adjusting the diet during a case of gastritis, be sure of the following. Eat 5 to 6 small meals a day, as this can reduce the impact of stomach acids. Hydrate often by frequently consuming water. Add omega-3 supplements to the diet, as they may play a role in resolving gastritis. Nursing management. One risk for deficient fluid volume related to inadequate intake, vomiting. 2 imbalanced nutrition, less than body requirements related to inadequate intake, anorexia. 3 acute pain related to inflammation of gastric mucosa. 4 activity intolerance related to physical weakness. 5 knowledge deficit, about diseases related to lack of information. Prevention. A person can reduce the risk of developing gastritis by following these steps. Practice good hand-washing hygiene and eat well-cooked food. This reduces the risk of contracting H. pylori. Avoid certain medications, smoking, caffeine, and alcohol. As some causes are unknown, there is no way to fully prevent gastritis.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.